Well, hello. My name is John. I'm a student nurse practitioner here at the clinic.
Hola, mi nombre es John. Yo soy un estudiante de enfermería practicante aquí en la clínica.
What's your name?
¿Cuál es su nombre?
Mi nombre es Wendy.
My name is Wendy.
Okay, what's going on today, Wendy?
¿Qué es lo que está sucediendo, Wendy?
Tengo un dolor aquí.
I have a pain right here.
Okay, how long has that been going on for?
¿Y qué tanto tiempo ha sucedido esto?
Creo que por 3 meses más o menos.
I believe like for 3 months, more or less.
Can you ask her if the pain gets worse if she
¿Me
eats
puede decir si su dolor se empeora cuando come?
Sí.
Yes.
Has she had any nausea or vomiting?
¿Ha tenido náuseas o vómito?
Sí, también.
Yes, also.
Does she throw up every time she eats?
¿Se vomita cada vez que come?
No, pero me da náusea cada vez que como.
No, but I get nauseous every time I eat.
Can you ask her if there are any types of food that make it worse, like fatty foods, or if she has any problems with her bowel movements, or if it hurts all the time, or at night, or anything like that?
Para ir al baño si le duele durante en la noche.
Bueno, estoy un poquito confundida porque está hablando bien rápido.
Okay, I'm confused because you are speaking a little bit fast.
Oh, I'm sorry. This video is meant to be used by student nurse practitioners who may be working with medical interpreters for the first time in a clinical setting. There are approximately 60 million people in the United States who speak a language other than English as their primary language. When these individuals interact with an English language dominant healthcare system, they are at an increased risk for medical errors related to miscommunications. One of the best ways to overcome a language barrier in a clinical setting is through working with a professional medical interpreter. We will discuss 4 key areas of well-researched best practices that student nurse practitioners should consider using when working with medical interpreters in a clinical setting. Introductions, or introducing the interpreter by name and role, can help identify for the patient who the interpreter is and that they are part of the healthcare team. Positioning the interpreter appropriately in the room can be helpful for maintaining the direction of conversation between the clinician and the patient. If the interpreter is sitting between the clinician and the patient, conversation can be directed away from the patient too easily towards the interpreter. Instead, having the interpreter stand behind the clinician or behind the patient can help the student nurse practitioner keep conversation directed towards the patient and encourage the patient to direct conversation towards the nurse practitioner. Conversational techniques such as using appropriate verb tense like second person verb tense instead of third person verb tense can also keep the conversation directed appropriately from the clinician towards the patient. For instance, instead of asking a question, does he or she feel pain, of the interpreter, the better way to ask a question is to directly direct it towards the patient, saying, do you feel pain? When did your pain start? Another important technique when speaking through an interpreter is to use short single idea sentences and to ask only one question at a time. And finally, evaluating for understanding is an important way that you as a clinician can know for certain that the patient has understood the information that you have tried to impart for the patient encounter. Simply asking the patient at the end of the interview to repeat back the plan of care can be effective in assuring you as a clinician that the language barrier has been overcome by working with a medical interpreter. For the end of this video, we'll look at a health interview using some of these best practice techniques of working with a medical interpreter. Good morning, my name is John. I'm a student nurse practitioner.
Buenos días, mi nombre es Jon, soy un estudiante de enfermería especializada.
Mucho gusto, mi nombre es Enrique.
Nice to meet you, my name is Enrique.
And nice to meet you. This is
Mucho
Wendy.
gusto, esta es Wendy, soy Wendy.
And she's an interpreter
Y yo soy un intérprete
who will be interpreting with us
que
today.
le va a interpretar hoy.
What's
Sí, me
going
disculpa, perdón.
What's going on this
¿Qué es lo que está pasando con usted?
Pues tengo una molestia aquí arriba, no sé qué sea.
Discomfort up here, I don't know what it is.
When did it start?
¿Cuándo comenzó?
Empezó hace 3 semanas.
It started 3 weeks ago.
Okay. Have you ever had this problem before?
¿Ha tenido este problema antes?
Pues no, me dolía antes, tenía piedras en el riñón, pero no se sentía como esto.
No, before I had stones in my kidney stones, but I didn't feel like this before.
Okay. Have you taken any medications for
¿Ha
this?
tomado algún medicamento para esto?
Nomás he tomado Aleve.
I just taken a leave.
Okay. Did that help?
¿Eso le ayuda?
Me ayudó un poquito, pero no mucho.
It helped a little bit, but not much.
Okay. All right. Does there seem to be any foods that make it worse?
¿Alguna comida que le empeore esto?
No, o sea, nomás tengo ganas de vomitar a veces, pero no.
No, just sometimes I feel like throwing up, but no, not really.
Anything that makes it better?
¿Algo que le mejore?
A veces nomás poquito el Aleve, pero no mucho.
Sometimes a little bit of Aleve helps a little bit, but not much.
Okay. Have you had any fever or chills?
¿Ha tenido fiebres o escalofríos?
No.
Okay. Have you lost any weight with this?
¿Ha perdido peso con esto?
No he perdido.
No, I haven't lost.
Okay. Have you had any surgeries or operations?
¿Ha tenido alguna cirugía o operación?
No he tenido.
No, I haven't had any.
Okay. All right. Well, sometimes when we have pain in this area and it gets worse with food,
Algunas veces cuando tenemos dolor en esa área y se empeora con la comida,
we think about the gallbladder.
creemos entonces que es algo relacionado con la vesícula biliar.
There are tests that we can do in the lab with some blood tests or with an ultrasound.
Hay exámenes que le podemos hacer en el laboratorio de exámenes de sangre o un ultrasonido.
And that can help us know if that is the gallbladder causing you a problem.
Y eso nos puede hacer saber o ayudar a saber si es que la vesícula biliar le está causando problemas.
So we'll get you set up to have some of those tests today and then see you back on Friday to discuss them.
Le vamos a hacer una cita o programar citas para que le hagan esos exámenes hoy y ya le vamos a ver otra vez para discutir los resultados.
Just to make sure that we've understood each other well, would you be able to tell me back kind of our plan for today, what we're going to do?
Solo para asegurarnos que nos entendimos cada uno, dice, ¿puede decirme cuál es el plan y qué es lo que pensamos hacer?
Sí, entendí que me va a hacer exámenes de laboratorio de sangre.
I understood that you're gonna do some blood tests, some lab tests.
Para checar si tengo algo mal con la vesícula.
To see if there is something wrong with my gallbladder.
Yes, that's exactly right. Good.
Okay.
Well, thank you so much.
Okay.
I'll see you Friday.
Gracias.
Mucho gusto, lo veo el viernes entonces.